Melanoma. This is a mole that has undergone malignant changes. A malignant melanoma is the most deadly of all skin cancers. Normal moles are usually uniform in color, being brown, black, or tan. They will have even borders and usually no larger than the diameter of a pencil's eraser. Moles may change in appearance over time, some are known to even disappear. Some moles may become larger over time, may develop a mixture of color, or may develop uneven borders. These moles are known as dysplastic nevi and are more prone to becoming malignant. People at high risk for developing melanoma are those who have a family history of or have had a melanoma in the past. Unusual moles on the skin, or changing moles. Fair skin, light hair, and eye color, who sunburn easily or tan with difficulty. A history of painful or blistering sunburns as children or teenagers. Since skin cancers are known to develop more commonly in the area of bands, back, arms, neck and scalp, which are the areas most exposed to the sun, you might be wondering why I am discussing this condition, since this website is devoted to foot problems and the feet are generally not exposed as much to the sun as other parts of the body. It is precisely for that reason that I am discussing this condition, to make my readers aware that they can occur on the feet, and the feet themselves have certain characteristics that may promote the development of this malignancy. The incidence of melanoma is equal between men and women, but in the lower extremity it is more common in females than males. The majority of cases present between 30 to 60 years of age. There are 4 different categories of this malignant mole, some of which are more virulent than others. Bottom of the foot or in between the toes is 2 areas of concern. The reason we worry about moles in these locations is because of the friction that occurs on the skin in these areas. Any moles that develop are more prone to undergoing malignant changes due to that excessive friction. So, just because a mole grows in between your toes and you figure it could not have possibly been affected by sunlight is no reason not to keep an eye on it or have it inspected by a doctor. Underneath the nail. Any dark discoloration underneath the nail whose origin cannot be explained needs to be examined. In the vast majority of the cases, the discoloration that may occur under the nail is either from trauma to the nail and the subsequent bleeding that occurs, or from a fungus growth that may develop. In both those cases, the discoloration should grow forward as the nail grows and eventually will be cut away at the end of the nail. If there is a dark discoloration under the nail that does not seem to be growing forward, it just stays in the same place, then that discoloration should be considered suspicious, and should be biopsied. Regular self-exams, all over your body, is the best way to become familiar with the many moles and spots you may have on your skin. In self-examination of your moles, you need to inspect them for certain characteristics according to their size, color, shape, and edges. These are known as the ABCDs of self-examination. They stand for asymmetry, border, color, and diameter. Asymmetrical, meaning a line drawn through them will not create equal matching halves. Border, meaning that normal moles have even borders, but malignant moles frequently have uneven borders. Color, of brown, black, or tan is normal, but once a mole starts having different shades of color it becomes suspicious. Diameter, of common moles are usually the size of a pencil eraser head in diameter. Early malignant moles tend to be larger than that. To further complicate the diagnosis of this malignant mole, there is a variant known as amelanotic melanoma. This is a melanoma with no pigment, meaning it does not have a dark discoloration to it. Because of their lack of color, these lesions are frequently diagnosed later in their growth, meaning they tend to be deeper and more invasive. Fortunately, they do represent less than 5% of all melanomas. They may be misdiagnosed as eczema, granulation tissue, and paronychia, infected ingrown nail. When appearing on the skin, amelanotic malignant mole will present as a pink, reddish, or even flesh-colored. The diagnosis is generally not made until the lesion begins to grow, or begins to itch, or becomes painful, or even begins to bleed. In many instances, these lesions will be irritated from chronic shoe or clothing irritation. As stated before, it is important to examine all your moles on your body. Dermatologists recommend yearly examinations. As a last comment, just because a mole somewhere on your body appears uncharacteristic, it does not mean it is malignant, but what it does mean is that you should have your doctor look at it immediately. A biopsy is the only way to determine the identity of the mole. Read the complete article at www.foot-pain-explained.com/melanoma.html.